It seems like I have testicular cancer. I went to get a vasectomy last Thursday, May 7th, 2026, and the urologist performing the operation found a lump on my right testicle, sent me for an ultrasound, and it came back that there is a mass on my right testicle. I'm scheduled to have an orchiectomy tomorrow, May 13th, so the process has moved pretty fast. I'm 35 years old. I have a 16-month-old daughter, an extremely loving and supporting wife, a great support system, and I'm terrified. I've never had any health complications or issues in my entire life. I'm in great shape. I have never had any trouble. So to be told that I potentially have cancer is shocking. I'm extremely not afraid of the operation, but more afraid of the future, what the future will hold. Will I get to see my daughter grow? Will I get to see her graduate high school? Will I get to see her get married or have kids of her own and be a grandfather? Will I be there to experience life with my wife and still love her like she deserves? There's a lot of uncertainty in the future, and it terrifies me. I have always had the mindset in clinical, I'm a physical therapist, so in clinical practice of telling people that it's not so much about what happens to you in life, because things are going to happen that are bad or sad or heartbreaking, that it's more important how you react to it. That when you do get hit and pushed down, that you're able to endure it and keep moving forward, because that's what matters. And that's the mindset I'm trying to take now. Whether I win this or not, I'm of the mindset that I want to make choices and handle this in a way that I could be proud of myself in the future, and a way that my wife can be proud of me and my parents can, and that set an example for my daughter in the future when something bad happens to her, that she can look and say, hey, this is how dad handled this. This is how dad had cancer, and this is how he went through it and handled it and still loved me. And that's what I'm focused on now, this moment and the next, because it's all a test that I can only take one time, and I want to pass it. And not only pass it, but be proud of myself and make those that are in my life proud of me. So I'm not going to wallow in self-pity. I'm not going to be defeated, even though I'm terrified in the face of whatever outcome, however terrible I'm feeling, or however scared or horrified. I am going to stand tall, be proud, and be stronger for myself and those around me. So the next step is surgery tomorrow. And I will give a little information here just of the nature of the findings on my case, with some training footage here from this past week. I just finished the last workout going in, had a great one, feel good. And I hope to be back up and training here in a few weeks. So here's some weightlifting footage. You don't care about that. At least it's better than hearing me talk in the car. This is what my case looks like.
Here's a few clips of some of the training I was doing in the days after the diagnosis and surgery scheduling. So figured, hey, why not? Let's just take hack squats, high repetitions to failure, and some other exercises. So that's what this is. But training has always been an outlet for me and something that I invest in. It feels good to push yourself, to push past your limits and what you're capable of in that quest for self-improvement. So that's going to be a major driving force and internal intrinsic motivation for me to get back to. Yeah, let's talk about some of the diagnosis in this process. The ultrasound came back with a 0.7 by 0.4 by 0.4 centimeter mass on the superior-medial aspect of my right testicle. So what that means is there is a less than 1 centimeter growth in the upper medial or middle portion of that testicles. That means toward the middle of your body, midline. So I can definitely feel it now that I'm searching for it, and it feels just like not even as big of like the tip of an eraser on a pencil. So that was found along with the enlargement of my epididymis tail, which was, I believe, about 1.2 centimeters, and two epididymal cysts as well on that ultrasound. So the official measuring was right testicle was just a few tenths of a centimeter larger than the left. And visually, when I take a look at the comparison, there's not really anything there to compare if you're not actually hunting for these little growths. So there's no visual distinction in the size from my right to my left or feel. I got the blood work done, which were the tumor markers for 3 different types of chemicals, we'll call them in cut through the jargon, that your body produces with tumors. So all 3 of those markers came back normal for me. That doesn't mean that it's not cancer, because oftentimes one type of the cancer, a seminoma, does not produce any elevation in these blood markers. So it's just one piece of the puzzle to compare back to later on in the process. But after the ultrasound, the blood work is ordered, and then the urologist I'm seeing called back almost immediately and said, hey, we need to remove this testicle. So that is going to happen tomorrow. After just doing some understanding of things, the smaller a mass growth is, obviously the better. Usually the marker is below 4 centimeters, but ultrasound is not always completely accurate in the size. So it may be bigger than that, especially just because it can't see inside the testicle. It's just on the outside. So the actual finding was that it was a hypoechoic, which means that it is a solid mass. It's not translucent like a fluid sac, like a epididymal cyst or something of that nature would be. So it's definitely solid. There was no mention of any increased vascularity in the mass on my ultrasound report, which is good. If there is some mention of increased hypervascularity or vascularity, that definitely means that the tumor is getting a blood flow and the cells are going to be growing. So don't know if that was just an oversight. I asked the urologist to clarify on that, and it wasn't much of a conversation in terms of finding anything. So the other part was partly exophytic. I believe that was the term, which means that part of the tumor was external to the testicle, and potentially some of it is on the inside. So the surgery will be tomorrow, and then we'll get pathology after that. So we were halfway through a diet when this happened for the summer. So this is how we're looking. I was really hoping to push this diet a little bit further and go to the beach with my wife and daughter and some friends for the first time. So I'm hoping that I can recover from the surgery pretty quickly. Just being in better shape, and holding less body fat, being a little more on the fit side of the spectrum going into this. So, like I said, I'm a physical therapist. I've worked with people recovering from major surgeries, similar to this in the kidney renal world. So I'm hoping I will be able to bounce back and not feel too much negative effects from the actual surgery, but we will see what happens from there. So this has been my story so far. We will definitely keep updating this through the story. It's going to be all raw feelings, footage, talking about it. I'm not going to edit anything. I want to be as transparent as possible for other people. So I love you, AJ, my wife, my daughter, and we will catch up in the recovery process.